Hello everyone, welcome back to Unified OSCE. Your success is what gives us joy. And in this video, I'd like to take us through the implementation station. The implementation is one of the four linked API, which is APIE, and we all know what it stands for. So we're focusing on the implementation, how to ace your implementation with Smile. Let's get started. What is expected of you? The allotted time for this station is 15 minutes. It is advisable that during your practice time, set your targets to be able to finish this practice within 12 to 13 minutes. You are expected to administer oral medication only. If you come across any other routes, for example, like salbutamol inhalation, please do know that you are not expected to give this. Just reassure your patient that you'll be back to do that once you're done with your medication. It's a skill on its own. You are expected to read the instruction carefully and put in mind the time you are required to give the medication. So look at your scenario in totality, please. Read all parts of the medication chart. There are two ways. Some school of thought says you have to read it with your patient. Some youth says you read it with your assessor. But what is important that every part of the medication chart, you have to read through all the parts, whichever choice you choose to go with. The assessor will be there, the patient will be there. So it depends on which one it's okay by you. So you are expected to give the medication due at your time. And for such medication that are due at your time, you need to explain what medication it is, the name of the drug, the action, indication, the dosage, the side effects, the expiry date, the batch number, and all. You need to state that. For diabetic tablets, you need to confirm the blood sugar. It's something we know, just to help us to put this in mind. If you are to give antihypertensive, you need to confirm the blood pressure reading again. For heart rates, for example, drugs like digitalis glycoside, you need to confirm the heart rate, for example, like digoxin. Be mindful of anticoagulant when you are dealing with subdural hemorrhage or you have a bleeding scenario at hand. Now, let's talk about the general tips. You need to pay attention to the prompts from your assessor or actor. No, the prompts can be towards pointing you in a direction. So be sensitive with things that happens around you during your implementation. You are free to check the BNF if you are in doubt of any medication. Some centers, they have the lamination copy. Some have the tablets. It's just a list of drugs that are used in OSCE, and you can always refer to it if you are not sure of any dose or anything you need to clarify. For PRN medication, check with your patient if it is needed. If your patient is on IV fluid, of course, you'll see the prescription of IV fluid in your MAT chart. Do a quick VIP score, but not as a skill, just the basic things. Check for redness, any pain, any tenderness. Then you can verbalize the VIP score, and you can move ahead. And if your patient is not on IV fluid, that will not be necessary. If patient is on oxygen, confirm if the set target is being maintained. You can confirm that with the assessor. And another point, never split or break a tablet to achieve a dose. For example, you have a high strength of 500 milligram and you feel, I need 250 milligram. Can I just split it? It's no. Be familiar with the allergens and the derivatives. For example, you know that when you're dealing with cocodamol, you're dealing with codeine and paracetamol. When you have penicillin as an allergen, be familiar with the derivatives like ampicillin, amoxicillin, augmentin, co-amoxiclav, and the rest of it. Now, let's move to the tips, things you need to put in mind when approaching your patient. Just like any other skill, any other station, you need a safety check, ensure the scene is safe. You need to provide privacy, do your hand hygiene, introduce yourself, state the purpose why you are there, gain consent, and your identity check. This is very important. You need to do it twice. Your identity by asking the patient to tell you the full name, date of birth, and hospital number. And if it is in a community setting, of course, you won't have ID band, but you can always check with the home address. You need to check for allergy check the red wristband for hospital scenario. And if you have a community setting, there wouldn't be a wristband. And also you need to go ahead to check what kind of reaction they get with the allergen. You need to do a comfort check. If pain is stated at any point, do a quick pain rating scoring and show some compassion. Do some intervention like deep breathing that can help to relieve the pain as you get ready to give the medication. Check for swallowing difficulty. Read the charts. Just for emphasis sake, I'm repeating that again. But your patient needs to know what you are giving, the action, the dosage, and the side effects. Apply your 6 C's all along. When reassurance is needed, show some level of compassion, be caring towards your patient. For the side effects, just give some form of reassurance that they may experience and they may not experience the side effect. And you will be there for 30 minutes just to monitor for effectiveness and in case they have any side effect. When you leave in your patient's side, do your hand hygiene again, give your call bell, and just inform your patient you will be going to serve the medication. Now, let's move to the tips, what you need to be mindful of when you are dishing or serving your tablet. Tips on administration of the medication. Ensure prescription is valid, legible, duly signed by prescriber with the GMC number. When you get to your trolley, your hand hygiene again. Confirm the medication trolley is under lock and is safe to use. Once you start dishing the medication, validate each tablet following your 7 rights and cross-checking and confirming with your matchers that you have the right medicine. You want to validate the expiry date, validate the strength of each tablet and how many tablets you need to decant. For medication due at your time, provide explanation, the indication, the dosage, and the side effects. This is very important. That is why it's coming again and again. So decant your tablets in the cover of the medication, then put it in a separate pot. And if you have to give two different tablets, let it be in 2 separate pots. Don't put it together. If you have 3 tablets to give, put it in 3 separate pots, medicine pots. No, just in case your patient changes her mind. That is why it is important. Put in mind that you need a 4-hour interval in between oral paracetamol before the next dose. If your patient's weight is less than 50 kilogram, the appropriate dose is 500 milligram. And if the weight is 50 kilogram and above, the appropriate weight is 1 gram. So have it in mind that you can't give 1 gram of paracetamol when your patient's weight is less than 50 kilogram. So you need to bear in mind the weight of your patient as well if you need to give paracetamol, and count and make sure you have 4 hours interval before giving the next dose. Be careful of start dose so you do not give a repeat or administer when it is not due. Okay, when you have a drug that is given already under start dose, when you have it in regular, please go back and confirm the time it was given. For PRN medication, check again if it is needed before you go ahead to dish it. Ensure once you're done with dishing out the medication, ensure your trolley is locked, or verbalize, you make sure your trolley is locked. Do your hand hygiene again. Then you can go back to administer the medication. Ensure your patient is sitting upright. Do a second identity check and allergy check, and what kind of reaction they have with the allergy. Check for preference. For example, do you want water first, or you want your medication separately, or you want everything at once? Give the medication and confirm it is swallowed or taken. You can do that by asking them to, can you open your mouth, or whichever way you choose to confirm that. Then you can take permission, do your hand hygiene, verbalize you will be around for 30 minutes again as a form of reassurance. Then take permission, sign and date the medications that you have given. Read instruction carefully, sign correctly at the right column, date, and print your name if needed based on the instruction. Impute the right code for the medicines omitted and put the code, circle it, and sign as required or as instructed on the match chart. Then you need to go to the last page and print and sign for omitted doses and fill all the necessary details, the reason why it was omitted or the reason why it was not given. And this part is very important. The front page where it says column for person administering the medication, you need to print your details, sign the column, fill the necessary details as required to show that you are the one that administered the medication. If that part is missed, is a fail. You must not forget to do that. Okay, so you need to check all your records if you still have time, and just check in case you miss anything out. Check for any needs from your patient side. Find out if they are comfortable and let them know you believe in them. Finally, do your final hand hygiene again. Give the call bell if it is inpatient or hospital scenario, and if it is a community, just instruct them to call 111 or call the GP number, 111 for non-emergency and 999 for emergency. And of course, they always have the GP number in case they have any need. They can always reach out to the GP. Thank you. That's all we have for you. Just make sure you keep practicing, and wishing you all the best. If you find this useful, click like, subscribe, and keep it coming. Bye for now.